Yeah. All right, Dr. Lee, let's get this thing going. We've been gone for
2 weeks.
2 weeks. It feels like forever. Hopefully, people didn't forget about us.
No.
This is nice to get back together. We are the Redox 5, formerly called the ASEA 5. We've been meeting mostly every Friday evening, at least in the United States, Friday. In the Asia Southeast area, it's been Saturday morning in Australia. But we've had a couple of weeks off, so this is we're kind of brushing some of the rust off and getting back into our weekly global webinar for the Redox 5. So by introduction, my name is Dr. Lee Osler. I'm in the state of Washington in the United States. And Dr. Maureen Hayes is also normally with us, and she is away at a family event this evening, and she'll be rejoining us as the summer matures, let's put it that way. We have Jim and Ann Glenn, if you could wave, from San Antonio, Texas. They're co-hosting with me today. And we have as a guest this evening the esteemed Dr. Aaron Kaufman from the great state of New Mexico. And so he's been with us many times in the past, but always brings a refreshing view of what natural solutions are. And we'd like to include ASEA in that in terms of our health. By way of disclaimer, we will state that we are independent associates working with a company named ASEA or ASEA Global. And this is a supplement, and it's regulated by the FDA as such, and therefore we do not make any claims to diagnose, treat, or cure diseases. The claims that or the discussions that we'll have not been FDA approved. That's plainly put out there by us. But we will be talking at great length about cellular health, which is really what this is about. And that's where I'd like to bring Dr. Aaron in to start us off. And maybe, Dr. Aaron, if you could give just a quick introduction about who you are. There's going to be many new people tonight as well as later watching the recording who may not know you. So tell us a little bit more about you, your background, why you're qualified to speak about this. And then maybe as you do that, you can launch into what is cellular health and what is this all about?
Well, thanks, Lee. I practice integrative family medicine in Albuquerque, New Mexico. I'm just starting my 39th year. And what that means is that I integrate Western medicine, traditional Western medicine with drugs and surgery and all that sort of stuff. But I also do a whole lot of alternative stuff. Everybody who sees me gets dietary recommendations. I give them recommendations for getting out of their chair and moving, exercise, walking, whatever. It's just a foundation for basically everything. And we have a dispensary with over 120 different herbs and homeopathics and glandulars and enzymes. I do more of the human identical hormones in gel form and pellets that are implanted under the skin than anybody in New Mexico for got to be close to 30 years, 28 years maybe, I'm not sure. I do a whole lot of regenerative injections, including proliferative therapy and PRP. I'm an osteopath, so I've been trained to use my hands to help the body heal. So it's basically whatever helps an individual in their particular situation to regain their health. I don't know if you asked me, Lee, but I'll tell you. I was introduced to ASEA 13 years ago and to redox biochemistry. And it was a relatively new science, still relatively new. It's been around since arguably 1998, when these three Italian PhDs won the Nobel Prize for proving that these molecules that we studied in medical school 40 years ago that we thought were waste products, they spun off as a byproduct of energy production inside the mitochondria, the little energy factories inside every cell. And they were negatively and positively charged. And again, we didn't think they did anything, so we didn't pay any attention to them. These three Italian researchers won the Nobel Prize for proving that they not only weren't waste products, they literally turned on and turned off or signaled every single process and every multicellular organism alive, whether it's plants, animals, or human beings. And so just for understanding, whoever's listening, you don't hear me speaking. You don't think a thought. You don't grow hair. You don't digest food. You don't take a breath. Your heart doesn't beat. That's not signaled or turned on and turned off by these redox signaling molecules is what they're called. And again, this really wasn't recognized until 98. And so in 2011, when I was introduced, like most people, and even still today, most people haven't heard of this. They don't understand redox biochemistry. It's definitely a burgeoning field. One of the first things I did was go to pubmed.gov, which is the US government's website for all the peer-reviewed medical research that comes out in the world every year. At that time, so 13 years after the Nobel Prize, there were approximately 6,000 articles there. So I started reading abstracts to get a sense, mostly in terms of pathophysiology, disease, what these were, how they worked. I looked at independent research on athletes that ASEA had sponsored up to that point, and it was very compelling for me. And I started to get a sense of what it was and how redox biochemistry functioned in terms of our health as well as disease. And so I started drinking. It had phenomenal athletic experiences, and next, more and more things for at least 5 years or so of drinking it, and started sharing it with family and friends and patients and so forth, and just seeing miracles. So that was my introduction. What is cellular health? By the way, few years ago, ASEA, officially their title was ASEA Cellular Health. I guess they've transitioned to ASEA Global now. But to me, cellular health, we are composed of cells, which compose tissues, which compose organs, which compose us. So our cells are the fundamental units of, our functioning body or any living thing. And Jim and I was kind of just touched on before we started here, it's a toxic world. Just being alive, just clapping my hands damages cells. And these automatic repair mechanisms kick in. Everything we do, we don't have to think, oh, I've got abnormal cells right here. I need to send, cells to heal, or I've, minimally damaged my cells, or I go to the gym and really push myself, or I get a bug or something. I don't have to think about how that happens. It happens automatically. Well, so cellular health is these recognition and detection pathways and appropriate response for what those cells need. So, that's kind of a little bit roundabout, but to me, cellular health is, as a practitioner, as someone who has used these amazing products for 11 years, it's teaching people how to help themselves fuel those mechanisms, turn on those mechanisms, signal their own recognition, repair, and whatever the cell needs processes.
Hey, Aaron, when do the problems begin? So when do people start declining? Can you kind of go through that process? Because people always ask, well, I'm healthy. I don't need this. They're healthy until they're not. They're healthy, they think they are, but so many people just kind of go along, well, everything's rocking along really good. I don't need it again until they do. But when does the decline start?
How far back in utero do you want to go? I mean, as soon as, we become multicellular, we start suffering the slings and arrows of outrageous fortune. We start to, have things happen, something toxic the mother is exposed to. Certainly when we're children, we didn't talk about this, but we're flush with these redox molecules. And therefore you think about, who needs these? Everybody who has cells.
Yeah, that's kind of what I was getting at. When does that decline start? And you just kind of said it around puberty.
Well, that's part of it, but it's progressive. And yeah, we stop making as many redox molecules at puberty by about 1% a year, unless we've got something horrible going on. We sit in our chair too much, we eat American food, and things break down. But, kids who have issues need this. And there's, you've heard the thousands and thousands of stories of kids who have dramatic improvements, by supplementing these redox cell signaling molecules. So, I would say it's a progressive thing, it's an individual thing, but everybody who's alive needs it. And yeah, what you're talking about, Jim, people who are, 25 and an athlete and they eat really well and take care of themselves, they're not going to have the degree of need that somebody who's 80 and has all kinds of diseases has. But nonetheless, everybody who's alive needs replenishment.
Yeah. Well, and you've talked about the athletes, and we work with Rose Monday, who was the head coach of the 2020 Women's Olympic track and field team. And she's in Paris now, and one of her athletes is on the product, and she's going to be running for Australia. So I was talking to someone actually yesterday, and she's got a good friend who has an 11-year-old that's a top high level swimmer. So even at that age, because they are doing, even though they have a plethora of these molecules, but extreme exercise can also have damage on the body, right?
Yeah, certainly. That's part of natural athletic development. You break down, you push muscles and, all our organs and so forth athletically, and then you have to repair them. That's why athletes can't, do whatever it is they do every single day at full tilt boogie. They have to, take off days or, lower level of performance. That was what was so amazing when I came on in 2013 and I met James Lawrence, the Iron Cowboy, and he just did remarkable things using this. He would do, he did, you guys know this, but probably a lot of people don't. James Lawrence, using this, although he was no longer a sponsored athlete, but he used this in large amounts, ran a full Ironman every day for 50 days in 50 states. And I mean, it certainly took a toll even with this, but, it just bespeaks, yes, athletic performance, particularly extreme like that, takes a toll. And this makes a huge difference. I drink 8 ounces before I go to the gym, and I work out for an hour and 20 minutes, really hard. And I have great workouts because of it.
Yeah.
If I didn't do that, I would be hurting the whole time.
If someone asked who the Australian the runner is, and I know she does the hurdles and she's in a relay, but I'm not sure exactly what her name is. I should, but I don't. I'll ask Rose. It's too late now, but real quick, let's kind of backtrack a little bit, Aaron, about your entry into ASEA. It really wasn't a very pleasant experience for the one that introduced it to you.
I don't think it was that bad. She tolerated it well. I was just network marketing averse. I had had bad experiences in the into the 80s and 90s. And I was just, there was so much hype and misrepresentation. I basically went, I'm never going to do this again. That's not me. I don't do that kind of thing. I try to be sincere and honest and so forth. And, I had had enough. And for 15 years, everybody, doing integrative family medicine, people are bringing me the latest, greatest juice and antioxidants and zeolites. And so forth. And it's like, I would say, is it network marketing? They'd say, yeah. I go, no. And I don't want to even hear about it because I thought that was what was going to happen. You're going to hype people and pressure and all that misrepresentation. And Dr. Edmonds came along and she introduced this to me. Number one, I'd never heard of it. And number two, it was network marketing. I said, no, absolutely not. And I was serious. But she was smart. She kept dripping on me. Again, at the time, all the research on ASEA, and that was the only product. There was no gel, there was no other. It was just the flagship product of ASEA, which we now call ASEA Redox. And the early research they did, because the founder, Virgis Norton's son-in-law, was a high-performance cyclist. He started drinking it and noticing he was having improvements in his performance. And so they went to Appalachian State, Dr. David Neiman, who is an exercise physiologist, very prominent exercise physiologist researcher, and they funded him to do research on high performance cyclists and mice. And they found that the cyclists would go 12% further before they hit VO2 max. They hit the wall, the runner's wall, whatever you want to call that, which is coincidentally, not, but coincidentally, I was running out my back door. I live at 7,000 feet above Albuquerque and Cedar Crest on the edge of the Cibola National Forest. And I would run out my back door 3-4 times a week sometimes, and up to 8,000 feet and back. And there were 8 places where I'd hit the wall and I'd love the feeling of pushing my limits, and I'd have to walk for a few minutes and then I could run again. And there were 8 places where I was doing that. Well, that's exactly what the research was about, hitting the ventilatory threshold. And they did some metabolomic studies, which basically means they were looking at the precursors and the intermediaries to the energy production cycle, the Krebs cycle inside the mitochondria we were talking about earlier. And they had to repeat the test twice because they couldn't believe what they were seeing. They had been looking at energy drinks and that sort of stuff, which might move 1 or 2 of those little metabolites a little bit. And this had shifted 43 of those metabolites in a dramatic direction, positive direction, which in other words is saying it's enhancing energy production and utilization. And the other study was on mice, and they would go 29% further before they were exhausted. And the old saying was, mice don't just run 29% further for nothing, no placebo. So all of that was really well done studies, independent, but double blind, placebo control, randomized, and the athletes had crossovers and washouts. So I finally started drinking. I'd been to PubMed and I finally started drinking it. And then I started powering up the mountain harder and faster. All those 8 places, I would go like 20 to 50 yards further up the mountain. And within 3 months, it was a month before I turned 60, I set new personal best times for these trails that I'd been running for 16 years at that time by 20%. So I go to her, just apropos of what you were saying about this poor woman who sponsored me. I go to her and I said, and then I started sleeping better, like I hadn't slept in 20 years, and I stopped hurting one thing after another the next year. And I was upset. I said, I'm going to have to drink this for the rest of my life. and it's not cheap. And she puts her hands on her hips is what I remember, maybe not. But she says, well, if you tell 6 people about it, yours gets paid for. And of course, network marketing averse. I'm going, oh. And I remember I'm sitting in my office and some patient is telling me about something. And I'm kind of going, back then, all we knew was it helped athletes and really sick people. We didn't really understand what it did. And I roll my eyes and I go, I've been drinking this stuff called ASEA. And they looked up and to the right and I go, no, it's not the acai berry. And they go, oh, okay. Right. And I said, I'm running faster and I'm sleeping like I hadn't slept in 20 years. And one thing after another is not hurting. And they were leaning in. Two of the first 10 people I talked to raised their hand and said, I want that. And the first one, I was so shocked because of my previous experience. I said, you do? And so I guess that goes to show you that if you have belief and enthusiasm, it doesn't matter what you say or even somewhat how it comes across. People will go, I want that.
Right.
Well, Lee, I was going to say, why don't you kind of jump in and maybe share because you kind of had a similar distaste of your chicken bone in the throat.
Well, before we get there, let me come back to that in a minute because I wanted to follow up what Aaron was just saying. You mentioned in your introduction that you have, all these dozens and dozens of supplements and nutritional support that you've been using professionally with your patients for a very long time. So maybe you could just kind of answer the question, what's the difference between what we're talking about here in cellular cell signaling support? What's the difference between that and what we call a nutritional supplement or nutrition?
Yeah, good question, Lee. So the Food and Drug Administration in the United States and the equivalent organizations in a lot of countries around the world where this is marketed consider this a supplement. It's not a drug, and that's why you'll hear us talking about a condition where something is going on. If we say this treats some disease, the FDA says, oh, that means you're a drug, and we're off the market. So we're not being evasive by saying a condition where something is going on. We're trying to be compliant. But, even though there's not a shelf in the health food store for cell signaling supplements, this is it. These products are it in the world. We're lumped together as a supplement. Obviously, nutritionals, which we make the best of the best of, have some nutritional value or complements to cellular process. These redox signaling molecules that are in these products, these redox products, are, again, non-nutritional. They're 2 and 3 and 4 atoms in size. So when we drink it or put it in our skin, it doesn't have to be digested and restructured and so forth to be utilized in the body. It's absorbed directly. And again, tiny, tiny molecules. So as soon as they touch your mucosa of your mouth or your skin, they're inside, again, directly absorbed, and they're turning on these cascades, all these things we were talking about earlier, these processes that make cells work like when they were younger. Literally, what we were talking about earlier, starting at puberty, we make less and less and less. I'm 71, I'm good shape, but I probably am making less than half of what I did when I was a child. This is the first time we can replenish those, and so it youthens our cells. Aging, real important concept, aging is a deficiency of redox cell signaling molecules. So you can take the best of the best supplements, nutritionals, homeopathics, glandulars, enzymes, all that kind of stuff, and they will support processes if they are targeted well and if that cell can utilize it. What I'm fond of telling people is, okay, you're drinking an energy drink, you're drinking, a protein shake, you're, taking a homeopathic, getting acupuncture. No matter what you're doing, it's going to work better if you're turning on your cells to utilize that. Did that answer your question, Lee?
Yeah, it does. I think sometimes we get so spun up in our languaging, about just what health is that we're talking about almost these magic potion kind of things across the board, and often we forget maybe to go to the end result and reverse engineer the question. Sometimes we're just not asking the right questions. The answer that we want to wind up is how do I turn on my cell defenses? How do I anti-age? How do I resist premature aging? We can semantically argue, well, we all are going to age because we do. That's just we're being as part of being mortal, but the real question to ask, I think, is to say, if I want less of that, if I want more cell defense, if I want to repair my DNA more, what is it that I have to do? And the answer is you have to turn on the processes that activate those cell defense pathways. And that is what signaling does. And this is a new concept in all of healthcare, because we've never really had the ability to do that outside of indirect support from nutritional supplements.
Yeah.
And so we're not at all saying that nutritional supplements are not valuable. We're just saying that that is an indirect way of doing what ASEA is doing directly by activating those cell pathways. So I appreciate your answer there, and I thought if anybody could answer that, where you actually literally practice that for 40 years and have great experience with patients, but this is different, and that's why this is unique in the marketplace. Nobody else has this.
I think it's a good comment, and I flash on, Lee, is not just my career, but the history of medicine, healthcare, whatever, and this evolution and the next greatest thing, from penicillin and, vaccines and so forth and so on, and we keep evolving. I think we're at a sort of a crucial place. You were talking about people looking, the whole antioxidant phase, and, vitamins weren't used much until 50s, 60s. And this is so foundational. I'm sure other stuff will come along, but nothing is going to ever be more foundational than this. I hadn't really thought about that. But yeah, there's going to be more things and so forth, but something that turns on cells is, how do you get any, and it's, molecular. How do you get any more basic than that?
Well, there's a question that was just asked about how do you explain this, and I'll tell you how I typically talk about it, and it's parallel thought to what we just discussed. That the end result is I want to turn on cell defenses. I want cell rejuvenation. I want to turn on what we call autophagy, or which is the little Pac-Man that's going around the cells, eating up, the damaged folded proteins and repairing and so forth. That's the end objective. But we are wired, we're designed in a way that there are specific mechanisms or pathways, we call them pathway genes, that are switches. They're cellular switches. They turn on and they turn off. And this is one of the different concepts, as opposed to nutritional support, is when I top load nutrition, when I'm eating foodstuffs or nutrition or herbs or anything, I'm literally top loading that into my body. And as long as those ingredients, just like a drug, the more drugs I take, the more impact they have within the body. They don't just stop when I don't need them anymore. They continue to have an effect. Well, redox signaling is a responsive mechanism. It turns off when I don't need it. And I liken that to a thermostat on the wall, that when the ambient environmental conditions in the room, or in this case, my cell, need correction because they're out of bounds, right? Then a thermostat kicks on, conditions the room, heats it or cools it, whatever, till it returns it to the preset point that's of comfort, of balance, or homeostasis, and then it turns it off. It doesn't continue to do its thing. And that's one of the magic things, I think, if there's anything magic, where all we're doing is what the cell was designed to do, and that is to turn on and turn off cell protective mechanisms. And we call that hacking or biohacking. This is the new age, right? This is the new age of anti-aging, and this is the biochemistry that's related to the cellular switches that turn on and turn off the processes that resist aging and promote wellness.
That's a great thought, Lee. As you were saying that, I was thinking about the thermostat. Well, we have, thousands of little stats defense stats and, repair stats and so forth, all these little registers. Somebody used the analogy a long time ago. It was like this Navy SEALs team that's like cruising through your body, and it's like they're dangerous, but not to you. And as soon as something pops up, boom, they're on it. And that's that cellular efficiency. So yeah, it's a fascinating concept that these mechanisms are just, when they're primed, when we take care of ourselves, when we're younger, when we replenish with these and turn on all those autophagic processes and apoptosis and all that, that boom, they kick in. And when we don't need them, when we're in the, hormesis in, reductant oxidant balance and so forth, they don't need to be kicked in. So yeah, that's a great concept. I like that.
Yeah.
But I still want a chicken bone story.
Well, I want to, as the non-medical person here, Anne's got nutrition, you guys are what you do, but it honestly sounds crazy. I mean, did you not think this was too good to be true, Lee? I mean, if you really tell people what it does and they've never heard of this before, they're going, you got to be crazy. Back when I was a broker, if somebody would have come into my office and saying they had a company that did this, I would have said, bye. There's no way that something from saltwater can do this. So keep it simple. What was it, Lee, that got you to do this? The chicken bone story.
Yeah, right.
So why?
So I mean, I think we all share this in one way or another. It's really hard to intellectualize. Maybe 1% of people will intellectualize themselves into this, but the rest of us, we have some kind of an experience where it defies, our knowledge. It defies our experience. It does something different, better, stronger, whatever, in terms of its result. And for me, it was my wife. She's had, a very long time of health issues. We've been literally everywhere. We've had multiple different ideologies or, medical persuasions looking at her. And we were sitting in her physician's office one time and kind of commenting, complaining, whatever, that she was plateauing. It's like, whatever we're doing is just like not enough. And he said, well, I think you should try some redox signaling molecules. I can remember just like it was yesterday looking at him and saying, well, what is that? And he said, well, just go Google it and get some. Now, he wasn't involved at the time. He had just heard this. So that tells you he's kind of scraping the bottom of the barrel in terms of, what he thought he could provide as a physician. He'd already checked a lot of boxes off and nothing was working. And so I asked him again, I go, yeah, but what is that? And he goes, just Google it and get some. And that was the end of the conversation because I don't think he could tell me much more. So anyway, I dove in and I did some my own research and we found a source. I didn't, at that time, really didn't comprehend what even the business model was. It was an online source. I got some, we tried it, and within about 48 hours, it was like flipping a switch for my wife. She just came alive. And that was jaw dropping. We had a fairly large, experience base of things that didn't work. And all of a sudden you're observing and feeling and seeing and witnessing. And so that really kicked in to.
How long had she been dealing with that issue prior, Lee? How long was she like that?
Probably 35 years. It was a long time. Yeah, it was a long time. And, she's had surgeries and I could go on and on, but this made a profound difference. Now, we need to be real here and say that you don't just do this and suddenly everything going wrong with you gets better. There's history. Everybody's got history. They've got problems. They've already had pieces and parts of their body removed or surgerized, and that, you don't undo that kind of stuff. But starting with where we were at, suddenly her cells started working. And she went through a fairly significant detox period of time for a month or two, which we had to work, we just had to kind of gut it out and work through it. but she started to do better. But at the same time, for mine, this is where my intellectual side kicked in, because I'm kind of brain damaged that way. I need to know why and how things work. And so I started diving into, the literature and tried to figure out from the science side of like, what explains what I just observed. And I had some people, I don't know if it was Dr. Kaufman or not, but there were some other physicians that were saying, well, can we get your bibliography that I was putting together? That's just how I do research. And I said, sure. And anyway, that's kind of where the books came from, is, but I needed to understand it. And I think that's important for some people, certainly for myself, to know that the science is real. This is not some hokey thing out that's coming out of left field. We just discovered this. This is new. And that's why if you went to talk to your physician today about it, they go, we don't know. My wife's physician, Dr. Lynn, didn't know at the time. And he himself did his own deep dive, thereafter, to figure out, well, when I treated Mrs. Osler, why did she respond the way she did? He had to understand it as well. And so it is new. And because it's not a drug, it doesn't sit on most physicians' radar screens or most health professionals. They're not going to view this because you don't evaluate it by those same standards.
So, Lee, real quick, how much was she drinking? And then, Dr. Kaufman, could you please pretend you're his doctor, Lynn's doctor, or your wife's doctor? And what was that detox stuff? Because people really need to understand this, because I've had people either go, it tastes like bad stuff, and they quit, and they don't understand it. So how much was she drinking in the beginning, Lee?
Well, for a long, long time, because we didn't know the difference. We didn't have anybody bring us into this that explained a whole lot.
Okay.
We were just doing the 2 ounces twice a day. And in fact, it was, the rest of the story is, as I started doing my research, I discovered, I'm a past president for the American Academy for Oral Systemic Health. We were having our annual scientific session in Las Vegas about a month later. And when I got online, I wasn't in charge of it anymore. I'd passed the baton. But I noticed that SIA was one of the exhibitors or vendors at this, professional medical dental meeting. And I'm like, holy cow, we just had this experience with this product. I'd never heard of it before. And now they're at my meeting. Mm-hmm. So I called up or emailed the person who was on the registration for the exhibit booth. I emailed her. It was none other than Dr. Maureen Hayes. I didn't even know her. And I emailed her and I said, what is going on? What is this stuff? I need to know, because I was going to, and I said, I'm looking forward to meeting you this weekend. It was that weekend, to find out what this is all about. And I said, if this is everything you're all telling me, it's like, well, I guess I need somebody. Would you be my sponsor? So before that, I'd never met her. I didn't know her. And to think that, Dr. Lynn was the one that pushed me here, but at the time he didn't know anything about it either. He was just trying to find something that might help her. Anyway, it's kind of a weird side story, and we can, it's not about me, it's about Dr. Kaufman tonight.
Well, but
that's how
Dr. Kaufman, yeah, but I want you to respond back to the detox. It didn't taste good, correct? And she had some feelings. Can you please explain that, Dr. Kaufman? So when people, if they're brand new and they start this and they can't stand the taste, what is that about? And why is the body going to go through a health episode, a cleansing episode, whatever you want to call it?
It's a great sign. It means it's working.
Yeah.
Can you repeat that one more time a little bit louder? No, I'm serious, because
I understand. It's
People don't think it when they're in it. Yeah.
right.
Yeah,
When they're going through the crap like she was.
I've had people, a doctor who I respected and all, two of them actually, now to think about it, that says this tastes like chlorine. I've been trying to avoid this kind of stuff all my life and so forth. Didn't even want to hear why it tasted that way. And another guy had a detoxification effect, an adjustment, we'll call it, and stopped it. And, some people it might be worthwhile starting them low. It certainly behooves us to tell them ahead of time, you may experience this. It is a great sign. It means it's working. When I drink this, everybody on this call, pretty much who's been drinking it more than a month or so, drinks this, it tastes like nothing. It's a great story about Harry Wan, who had a severe pancreatic condition, and he started, somebody gave it to him. He started drinking it, and he said, "Oh my God, it's awful. I'm not going to drink this." And his wife and his daughter drank it, and they said it tastes like nothing. Smart man. He goes, "I must be really sick." And
Right.
he keeps drinking it. And that was over 10 years ago, and he's fine now. So it's a phenomenon of when your cells are toxic, when your systems, your tissues, your cells are toxic. It's sort of like being, those medical atomic physicists use the term senescent to describe cells that are in bad shape. And it basically means senile. So you think about a little old person sitting there in the chair, and they're not really with it, and the garbage is piling up and so forth. And they don't even recognize what's going on. That's what our senescent, that's damaged, old, non-functional toxic cells do that. When we start youthening the cells, replenishing these molecules of youth that turn on cellular efficiency, well, guess what? The cell wakes up and goes, "Holy mackerel, there's garbage," and they start throwing it out. And that throwing out of the garbage, that detoxification, if you will, is why it has the bad taste. Why people for a few days, maybe even a week or so, tiny percentage, I don't know what your experience is. I would say like 2, 3, maybe as much as 4 or 5% of people will have a short detox, a short nasty taste. It's because the cells are taking the garbage out. If it's really bad, you can start at a lower dose. If they drink plenty of fresh water, not tap water, but filtered water or alkaline water or spring water, it helps to wash out those toxins. It's very short-lived, but it means the cells are waking up. It's a great sign.
Thank you.
You're welcome. You know what?
Well,
Your story. I mean, stories is what this is about. Lee nailed it. People understanding the science is about 1% of why they use it, if that. But
Yeah.
the stories is amazing. You've got a great story.
Oh yeah, he's a walking miracle too. So Dr. Sparks, she says during this adjustment reaction time, you may see this or that take place, but know that it's safe and that's, actually good for you to get through it, even if you have to rub extra renew. Or I was thinking about the difference between this and as simple as it is versus nutrition. I mean, if you have this or that going on, you can't just go in the kitchen and grab a handful of nutrition that has to be metabolized or grab a bunch of fruit and expect to see this or that go away. Here, you grab your gel, grab your gel, grab your spray bottle, spray in the eyes, spray in the ears, spray it in the nose, spray it on your dog, rub the gel wherever. And there are times that 3 times in 5 minutes, you will see that level of discomfort reduce. You can't say that with nutrition. That's what makes this so simple versus everything else that's out there. And then I'm not one that pushes meds, so I'm not going to say, oh, go get, we have a caretaker that helps my 87-year-old dad, and he takes half of our products, our 16 products. And every now and then she'll feel this or that. I won't be telling her ever to go grab an analgesic. I just go get this for her. Everybody's gotten used to it. Actually, in the house, it's called salve, and they don't even call it Renew 28 because my dad was so used to that in the military. That's all you grabbed was whatever. And so now he asks for this when this or that shows up. So it's just neat how the product works the way it does. But I was thinking at the beginning of the show, I had not seen your injury pictures, and people who are new, did you not have an injury several years
You
ago. that
had
were
a
pretty-
little boo-boo.
Those were pretty bad. And if people are new and they haven't been watching us for years,
Tell us the
they
story.
probably don't know how remarkable the changes are just by taking more SEO. Jim's had some doozy injuries.
Yeah, but not like that.
Drinking, spraying, gel, serum, now mask. You didn't even have mask, but show us if you can locate those, the transformation. That would be a pretty neat story.
Can you
So
pull it up?
you want to see the video?
Oh,
Yeah.
yeah. If I'm not mistaken,
Um,
it was
There's
short,
a
right?
setup to it. So again,
Yeah.
I've been a runner for 46 years. I was running in the mountains up here, and I had been the medical atomic physicist who was responsible for stabilizing these molecules and figuring out what they were, invited me to a conference in Chicago, and he gave a talk about redox signaling and autism, and it was an amazing talk. Somebody at the end of the talk asked him some question that he said, this should be, and again, this was the only product back then, this should be in every emergency room in the world, because if you can drink the redox molecules after a traumatic brain injury, you can save a lot of cells. Oh, actually, the gel had come out. But anyway, he was talking about this. 2 days later, I fly back to Albuquerque, and it's end of May, beautiful spring day, early summer day. And I head out the up the mountain, and I get up to 8,000 feet, and I'm starting to run down. And obviously, I tripped. The divine orchestration is, I can't remember it to this day. It must have been horrible. But when I came to, I pushed up from the ground, blood was gushing out of my head. And I couldn't see out of this eye because I had ripped this eyebrow loose. And it turns out it fractured my skull right there. It took me 20 minutes to get off the mountain. And on the way into the emergency room, when I got home, I drank a whole bottle of this, and I was rubbing the gel into the wounds, which, just for reference, stopped hurting like that and stopped bleeding. And so I'll share my screen.
Now, I've had multiple boo-boos too, Aaron, and the thing I've learned is as soon as you have a boo-boo, take a picture.
Yeah,
Well,
that's
somebody could if they're near to grab the camera. Maybe not the person hurt. They're
all
not
right.
thinking.
So that's the setup for this. So
Okay.
this
Here we
is me and Dr. Samuelson in Chicago, May 28th.
Oh,
And this is me in the emergency room. I got stitches over my 3 under, and on the bridge of my nose, there's a fracture there. And I was taking pictures because my sister in Atlanta wanted to know, how I was doing. And every day I'm rubbing the gel on, I'm drinking a lot of ASEA.
That's day 2?
Yeah,
Oh my
God.
I'm rubbing the gel on. I'm 63 years old. I've got the black eyes. That's called raccoon eyes. When you
I knew it'd been a while.
you bleed into the orbits. And you can see the swelling has already gone down. That line is back on the bridge of my nose where the fracture is. These stitches are out. Now all the stitches
Wow, look at that. 7.
and the raccoon eyes are almost gone. Yeah, tiny little bruising there. And in 2 weeks, a patient came in and said, I heard you had a bad fall at this point. And I said, I did. And she says, where? She couldn't see it until she got up close.
Yeah.
So I'll just tell you that a 63-year-old man doesn't heal that fast. So
Right.
that's what this does.
That's great.
Hey, Lee, do you have those pictures of your wife handy?
Yeah, we hadn't seen that in a while, so that's pretty neat.
Can you find those real quick? The thing I've been I listened to Alan Noble, his new amazing training, and discover redox-training.com. And I'm taking his advice. Actually, I'm taking my own advice. And I'll ask everybody listening to go to realredoxresults.com. Password is lowercase redox. And listen to 1, 2, or 3 testimonials a day. And it'll change your life. I've heard some, Aaron, that it's like, oh my Lord. And so many children. I I mean, congenital things and things that they've been dealing with for a long, long time. And it's just, the thing that people don't realize is when you have someone ill in the family, how it affects the other family members. Like with me, with my 10 back surgeries and addicted to pain pills, I would come home. I was a stockbroker at the time, and I would come home and sleep for what, hour and a half, 2 hours every day.
Mm-hmm.
I was a zombie because I didn't take any meds until after the market closed. So at our time, that's 3 o'clock, man. And I was still meeting with clients, but my pain was my level of discomfort was horrible. I was getting to the point where I had no hope. I mean, I was 58 years old and I had gained quite a bit of weight. My leg and my back were from the scar tissue, 10 surgeries, and they put that stimulator in my back, which I hate. But I got my life back. But when this is really interesting. Because I have my best friend, we have lunch every couple of weeks. And we were talking about the time he introed this when he made the phone call to me. We've been best friends for a long time. He said he was paranoid to call me. He was afraid to call me. I go, Robert, why? He said, because it was out of the norm of what he did. He wasn't used to that. But he made the call. And like Tyler Norton says, by the way, guys, next week we have Tyler Norton.
Mm-hmm. Great.
And I'm really excited about his topic, which is going to be, you were probably there, Aaron, maybe not, but when Vertus Norton did the Megatrends, okay, he's going to do an updated version of that, which is right up my alley. Did you find the pictures, Lee? Oh, cool.
Oh, yeah.
That's crazy.
Yeah, that's amazing.
That's crazy.
I love it.
Yeah.
Yep.
That's
Wonderful.
It's neat what the body can do when you give it the communication.
Yeah, that's just it takes your breath. I mean, so I don't know. I'm lost for words.
Well, and they have to take it long enough and take enough of it to see a change. It's not an overnight. You got to set people up with expectations.
But that's what's interesting, Lee. It took, you said, 2 weeks.
Well, the image that I just showed you was actually 5 weeks. It was from April to December, but it went from the last of October to the 1st of December, and so there was a 5 or 6 week time frame. But I would like to underscore something, and that is, I'm listening to this like somebody who's not heard of this or well acquainted with this might hear it, thinking that we're really talking about magic, that this is just like surreal. And if my doctor's all that smart and I really trust and like him, how come he couldn't help me with this? And the point is like, this isn't magic. The reason why ASEA's redox signaling molecules work the way they do is they are aligned with the rules of the cell. This is the way the cell is designed to work. And when you align yourself with that, that's why the next 20 years of anti-aging medicine and research is going to be so exciting, because that's more tightly aligned with the rules of the cell, these pathway genes, than anything else is. That's why we emphasize this is not a drug, it's not a medicine, it's not a treatment. We're just simply activating the inactive rules of the cell. They're already there. It's like biophysics. It's like gravity. It's like electrostatic, forces that attracted to each other. The way proteins fold on each other and gain their function is because they have certain positive and negative charges on them, aligned in a way that creates the folding that produces their function. We're just simply aligning. We're doing something that is aligned with the rules of the cell. And we're doing it in a direct way, not an indirect way. These are not secondary metabolites. And that's an important distinction when you think about the difference between what we have and what nutrition is, or herbs are. nutrition and herbs and those kind of things are redox active, they're bioactive, but they're not reactive. And there's a difference in it because we're dealing with charged molecules. They have a charge on them. That's what redox means. It's a reduction, oxidation, reaction. And that is what activates the cellular switches that we can then use to turn on the DNA on command. And that's what we're doing. And that's the difference, you see. And that's what's so exciting about this. It's not magic. We're just aligning ourselves with the rules that are already there, operative in the cell.
You know,
Excellent.
You know, when you were
there's
talking,
nothing, Aaron, there's nothing bigger than this. There's nothing that could come out that's more massive than what he just said. Nothing. You couldn't come up with something bigger than this. AI, as far as I'm concerned, scares me a bit, but it doesn't compare to what he just said. If you think about it, it's not just humans. It's your pets. And if you want, my plumeria and my Hoya and my night blooming Sirius, which is going to bloom maybe tomorrow night. Look for the pictures. But everything alive works on these principles. It just sounds nuts, but it's real. And listen to the stories. Go to realredoxresults.com, password lowercase redox, and I dare you, if you're new, listen to the stories. Lee, yours is there. Is yours there? No? Lee, I know yours is. Which is your number?
I think it's 95.
Okay.
Right.
We should get Aaron's on there.
Yeah, mine's
You
19.
should get yours on there, Aaron.
But real quick, Aaron, if you don't mind, I got my U.S. Marshal point here when I helped bust someone back when I was a broker. There's two sides to the coin, right? So you got that side, and you got that side. So the other side of the coin is the opportunity, which both you and we only have a couple of minutes, but you and Lee were, Lee had the chicken bone, and you were that. How has the opportunity changed your life, Aaron?
holy moly. Well, first of all, what you were saying about when you first heard about it is too good to be true. That I didn't think that. I was averse because of the model and what my previous experience was. But when I started learning about it, it's like, well, the first thing I did, I went to a conference in San Diego and met Gary Samuelson and was just so overwhelmed by him and Virtus and, people. I highly encourage people to go to the big events like the one in September in Salt Lake, because it just gives you such a massive picture. But I did a flip, not about the product. That kept expanding and I kept going, wow, this is cool. And, to this day, Lee and I go to the medical professionals meetings and it's just, wow, look at what we're doing now. And we start to see bigger and bigger and bigger pictures. And it's just overwhelmingly exciting. And where we're going is just mind boggling. But my conception of what this business was, and particularly and especially who ASEA Corporate was and who all of us were, just morphed dramatically, 180 degrees. Not only was it not hype and smoke and mirrors, it was the most principled, people who always did the right thing. Their mission statement is to better people's lives and be a force for good in the world. And it's not words. They espouse it, they teach it, they live it. No matter what they do, they make it right. They're not perfect, but if something screws up, they make it right. And I remember Jim saying early on, my first few months in the business, I said, these are the kind of people I want to spend the rest of my life with.
Wow.
And then I stopped saying it because I do now, So, I guess I'm not sure if that answers your question, but that was what changed for me.
Lee,
I think it does.
Lee, how big of a deal is this? Wrap it up. How big of a deal is this?
This is really a big deal because it's at the leading edge of the next 20 to 30-year revolution in healthcare. If you're looking for the ability to, you see everything in healthcare that we're accustomed to, we're both Aaron and I are in traditional healthcare, as it were. Most of what we do in that regard is an intervention. We are doing something to make up the difference or to compensate for a failure of what wasn't happening right at the cellular level. And so this foundation idea, the upstream idea, if we can correct the cellular function, then the intervention later is not needed or is needed to a lesser degree. And this is what we talk about in terms of longevity versus health span. We have longevity now, but the problem is people start dying at age 60, but they don't actually pass away till they're 75 or whatever, and they're kept alive through intervention, drugs, and surgery. The question is, how can I not start dying, as it were, in quote marks, when I'm 60 and I can live a healthy, vibrant life until the day I die or the week I die or whatever? I'm being, some of this is a little philosophical because that's just not what happens in today's society. But the point is, that's what we're moving towards, is the ability that I can stay healthy until it's my time to go. And I don't die 15 years prior to that, but I'm propped up using drugs and surgery. Now, again, we're kind of talking out of both sides of our mouth. If that's what I need, or that's what my grandma needs, or my, whatever, then I'm really glad that there are drugs and surgery that can extend my life and help me enjoy my family comfortably and keep me mobile. That's not what we're saying. That both sides of this coin are needed in today's real world. But when I'm presented with this, I now have an extreme advantage. It's almost an unfair advantage. I have the advantage of being able to correct the problems at their source. And this is what you call root cause. These are root solutions for a root cause rather than interventions. And so this is going to be a big deal. And that rising tide in the research community and the anti-aging community is going to lift all boats. I mean, we're not the only, people that are going to benefit. Everybody's going to benefit from this, and redox will become like Kleenex. It'll become a household name.
Well, and I believe we'll always be the only company that has it as well. Aaron, one last question, a quick response. Is it too late for anybody to ever start this, irregardless of their age?
No, because anybody at any point can definitely benefit from youthening their cells, turning on cellular efficiency. I've seen lots of people who, you've got 3 months to live, 6 months to live, get your affairs in order, and start drinking this and using these products, and they're still here. I also, be totally above board about this. I've had people who it's like they're going down the tubes, and the last few weeks, month or whatever, they start drinking it, and maybe they rally, and then, it's too far. They're already going down. So I would say the vast, vast majority of people, it's never too early or too late to turn on your cells, to have your body work like it did when you were younger.
Thank you. This was awesome, guys.
Always enjoy.
It'll be, I'm kind of lost for words. This recording will be up at Dr. Osler. Thank you so much for redoxmatters.com. Go to the video section. All the videos will be posted there. Again, next week we have our co-founder, Tyler Norton. And when he's on, you want to listen, and you want to get everybody on to listen. And so please, if you're listening to this live and you have questions, get back to the one that brought you on the call. If you're listening to the recording, give back. Don't go to Amazon. Go to the one that brought it to you, please. You can build a business here. You can't build a business through Amazon. And remember, you're here because someone shared it with you because of networking. Everybody's a networker, but not everyone's getting paid. We all share good things, but here we were able to get paid. I don't want Pfizer and Merck and, I don't want to make the Waltons richer than they already are. And I don't want, why not us? So give back, respect that. And if you don't share it, they won't hear about it. So guys, thank you. God bless. We love y'all. Maureen will be back with us next week with Dr. Osler, us, and again, Tyler Norton,
Can't wait.
co-founder.
Promote it.
Thank you guys. God bless. The recording should be up within the hour.
Thanks, Lee.
Thanks,
Have
y'all.
a great weekend.
You bet. And it will be posted up in the CU United as
Bye.
well.
See you
Thanks.
soon.
Bye-bye.
Thank you.
Thank you.